Ontario intensive care units have had just as many patients in them this winter as they did in 2020 when the Doug Ford progressive conservatives shuttered businesses, closed schools, canceled surgeries, and introduced indiscriminate mask, then novel mRNA vaccine mandates, making all of these measures especially infuriating to those who lost their lives and their livelihoods as a result.
We're 4 years into the pandemic now. I wanted to ask, when you look back on that, what do you see? What have we learned?
Well, what I learned is when we all work together, we put our political stripes to the side, we're unstoppable. I think we did extremely well compared to the rest of the world. Everyone pitched in, everyone helped out, from the manufacturers to the healthcare workers to industry. Everyone did an incredible job.
Tamara Ugolini here with Rebel News to highlight how Ontario ICU intensive care units are just as overwhelmed as they always have been, except that in the post-pandemic era, and with more people asking questions based on sound science and evidence rather than fear-mongering modeling, rational thought and logical decision-making seems to be prevailing. As pointed out by the anonymous government data dissecting and analyzing Twitter account Golden Pup, Ontario had just as many patients and more in the ICU this winter as it did during the winters of 2020 through to 2023, and yet he rightfully points out that nobody begged for a lockdown or for schools to close. The chart clearly shows a spike in ICU admissions as the novel mRNA injections rolled out after they were licensed under an interim order for emergency use authorization in December of 2020. Indeed, it was stated that the medical profession was traumatized by what happened in the months subsequent, January, February, and March 2021. That was the first 3 months after the rollout of these touted to be miraculous injections.
Why were all of the previously well-established pandemic response plans disregarded for these knee-jerk restrictions and mandates? And then how long will it take for the travel and tourism industry and sector to recover from the catastrophic failures of the Justin Trudeau Liberals with these unscientific mandates and restrictions?
So the second part of that question, I'm not sure, just because I don't work in the travel and tourism industry. But I will just say, COVID was very different than anything else I think we've dealt with in the past 2 decades. Really, since the 1918 flu, I don't think we've had a virus that's had this incredible transmission, that's had this variability in terms of symptoms, this very short incubation period, this huge level of infectivity, and really, being able to paralyze healthcare systems, as we saw, many of us were traumatized with what happened in January, February, and March of 2021, where, there seemed like there was no escape from this.
Yes, COVID was a different virus in that it only took the CDC nearly 4 years to declare it and treat it just like any other respiratory virus under a new, extraordinary, unified approach that always existed. The entire narrative around Premier Ford's ruthless shuttering of businesses was that we had to protect hospital staff and capacity.
This morning, I've declared a state of emergency in the province of Ontario. We're facing an unprecedented time in our history. This is a decision that was not made lightly. COVID-19 constitutes a danger of major proportions. We're taking this measure because we must offer our full support and every power possible to help our healthcare sector fight the spread of COVID-19. The first order under this declaration will be the prohibition of organized public events of over 50 people, including parades and events and services within places of worship until March the 31st.
And under that false mandate, Ford's reckless policy decimated the livelihoods like that of restaurateur Adam Skelly, who received the public health treatment with all of the Toronto Police Service's horses and riot men sent to shut down his business because patronizing it and his barbecue restaurant would lead, I guess they thought, to imminent death.
We'll pull the emergency brake for the entire province. All 34 public health regions will move into shutdown for a period
of 4 weeks. Friends, right now, we're into a third wave of COVID-19. The variants of concern are spreading rapidly. This is a new pandemic. We're now fighting a new enemy. The new variants are far more dangerous than before. They spread faster, and they do more harm than the virus we were fighting last year. My friends, above all, we need to preserve capacity in our ICUs and our hospitals. But because of increased cases of COVID-19 filling up our hospitals, we're on the verge of canceling more elective surgeries. And we already have thousands and thousands of backlog surgeries.
It all started with 2 weeks to flatten the curve. Due to these devastating surgical delays and cancellations, emergency room departments were empty. Instead of speaking up or advocating against unprecedented and knee-jerk policy, staff took to poorly coordinated social media dances to fill their time, as was the case with this video from Northumberland Hills Hospital in Cobourg, Ontario. The video depicts nearly 13 minutes of almost a dozen healthcare workers prancing around a completely empty emergency department in various ridiculously choreographed routines during peak COVID hysteria on April 20th, 2020, nearly 4 weeks into 2 weeks to flatten the curve. In a world gripped by fear and governments wielding the lockdown hammer with reckless disregard for the fallout and repercussions of such knee-jerk decisions, real evidence-based research shows that the same measures purported to safeguard public health have inflicted far greater harm. The toll on mental health, economic stability, and societal fabric is undeniable, while ICU numbers remain on par or even higher in 2024 than they were in previous years. It serves as a mockery of how these destructive one-size-fits-all measures and the false notion that lockdowns and mandates would somehow protect this very same capacity. For Rebel News, I'm Tamara Ugolini. Censorship was a big part of why the COVID scaremongers were amplified while everyone else was silenced, slandered, and smeared from coverage. This will continue under Justin Trudeau and his Liberal regime's censorship legislation. To find out about this and how you can support Rebel News in opposing state-sponsored censorship, please go to stopthecensorship.ca. That's stopthecensorship.ca.